Welcome to Dr. Mai, sharing medical knowledge. Today, we're diving into a groundbreaking advancement in the diagnosis of Alzheimer's disease, the development of a highly accurate blood test. Before we begin, make sure to subscribe to the channel, like this video, and comment below to support our channel's growth and suggest future topics you'd like to see. A major leap in Alzheimer's diagnosis. Scientists have made a significant stride toward the long-sought goal of diagnosing Alzheimer's disease with a simple blood test. A team of researchers reported that this blood test is significantly more accurate than traditional methods like cognitive tests and CT scans in diagnosing the condition. The study, published in the prestigious journal JAMA, found that the blood test correctly identified whether patients with memory problems had Alzheimer's about 90% of the time. In contrast, dementia specialists using standard methods were accurate 73% of the time, while primary care doctors were accurate only 61% of the time. Dr. Jason Karlawish, a co-director of the Penn Memory Center at the University of Pennsylvania, highlighted the revolutionary nature of this advancement. Not too long ago, measuring pathology in the brain of a living human was considered just impossible. This study adds to the revolution that has occurred in our ability to measure what's going on in the brain of living humans. Presented at the Alzheimer's Association International Conference. The results were presented at the Alzheimer's Association International Conference in Philadelphia. This is the latest milestone in the quest for affordable and accessible ways to diagnose Alzheimer's, a disease that affects nearly 7 million Americans and over 32 million people worldwide. Medical experts believe these findings bring us closer to a future where routine blood tests for cognitive impairment become a standard part of primary care checkups, similar to cholesterol tests. Dr. Adam Boxer, a neurologist at the University of California, San Francisco, expressed optimism about the future. Now we screen people with mammograms and PSA or prostate exams and other things to look for very early signs of cancer. And I think we're going to be doing the same thing for Alzheimer's disease, and hopefully other forms of neurodegeneration. The development of Alzheimer's blood tests. In recent years, several blood tests have been developed for Alzheimer's. These tests are primarily used to screen participants in clinical trials and by some specialists, like Dr. Boxer, to determine if a patient's dementia is caused by Alzheimer's or another condition. The new research was conducted in Sweden, and experts caution that the results should be confirmed in a diverse American population before widespread use in the United States. Selective screening and ethical considerations. Experts emphasize that blood tests should be just one step in a screening process, especially for people with memory loss and other symptoms of cognitive decline. Using these tests on cognitively healthy individuals to predict future Alzheimer's development is not currently recommended. As Dr. Oskar Hansen, a professor of clinical memory research at Lund University in Sweden, and the senior author of the study, noted, detecting Alzheimer's pathology in someone without cognitive impairment could cause undue anxiety and psychological stress, as there are no therapies to offer at that stage. Potential changes with new treatments. Testing recommendations could change if scientists discover drugs that can delay or halt Alzheimer's pathology in people who have not yet developed cognitive problems. For now, most experts believe it would be unethical to use such tests on asymptomatic individuals outside of research studies. Dr. Boxer emphasized the importance of this cautious approach. Most of us feel like it would not be ethical to use it in people who don't yet have symptoms unless it's in the context of a research study. The current standard of care. Blood tests should be performed only after other assessments, such as tests of memory and thinking abilities, and CT scans to rule out alternative causes like strokes or brain tumors. Additionally, blood test results should be confirmed by gold standard methods like PET scans or spinal taps that measure amyloid, a protein that accumulates and forms plaques in the brains of Alzheimer's patients. We advocate strongly that patients should still undergo the standard of care of today in both specialist care and primary care, said Dr. Hansen. Implications of new Alzheimer's drugs. With the recent approval of Alzheimer's drugs like Leqembi and Kisunla, which target amyloid, blood tests may also help identify patients eligible for these medications. These drugs may modestly slow cognitive decline in patients with mild stages of the disease who have amyloid in their brains. However, they also carry risks, including swelling and bleeding in the brain. Focusing on tau protein. The new study utilized a blood test focusing on a form of tau protein called p-tau 217, which forms tangles in the brains of Alzheimer's patients. Measuring p-tau 217 provided the most accurate assessment of Alzheimer's pathology compared to various other blood tests. Tau is more closely linked to cognitive decline than amyloid, with tau tangles forming later in Alzheimer's progression than amyloid plaques. The test also tracks amyloid, adding another layer of diagnostic capability. Current availability and future prospects. These tests are currently available in the United States for use by doctors, not consumers. Last year, a test measuring only amyloid was marketed directly to consumers, raising concerns among Alzheimer's experts. They believe doctors should determine who is eligible for such tests until preventive treatments become available. That company has since stopped marketing the test to consumers. Study details and demographics. The study included about 1,200 patients with mild memory problems, split between those who visited primary care physicians and those who sought specialist care at memory clinics. Dr. Sebastian Palmqvist, an associate professor of neurology at Lund University who led the study with Dr. Hansson, explained that the blood test results were compared with spinal taps or PET scans. The blood test was found to be most accurate for patients who had already progressed to dementia and slightly less accurate for those in a pre-dementia stage called mild cognitive impairment. It was not very accurate for the earliest stage, called subjective cognitive decline, where patients start to perceive memory issues but may not have Alzheimer's. Diverse patient outcomes. Patients who visited primary care doctors were older and had fewer years of education than those who visited memory specialists. They were also more likely to have other medical conditions like diabetes and cardiovascular disease. It was significant that the blood test performed well, even in patients with such conditions, particularly those with kidney disease, which can cause high pTau217 levels unrelated to Alzheimer's. Integrating blood tests into routine care. A remaining challenge is integrating blood test analysis into hospital laboratory systems, which currently require outside labs. Dr. Boxer and Dr. Karlowish hope that primary care doctors will eventually use these tests, increasing access to screening, especially for people from racial and ethnic minorities and low-income and rural communities. Don't forget to subscribe to Dr. Mai, sharing medical knowledge. Like this video, and comment below to support our channel's development and suggest more great topics. Thank you for watching.